families, creating a lifetime of memories. Sadly, some families are denied these important moments due to the sad practice of alienation. These are families divided.
Hello, everyone, and welcome to tonight's episode of Families Divided TV. Tonight, Dr. Stephen Lindenberg will speak about the carryover into adulthood of trauma to victims of parental alienation. Mental health difficulties, issues with self-esteem, and substance abuse are three adulthood manifestations of parental alienation. Relationships, learning and development, grief and loss, and disconnection and dysfunction are all attributes of parent alienation exhibited in adulthood. Dr. Steve will conclude his episode by suggesting coping, healing through resilience, and attempting reunification with the target parent. This is a great episode, and I know you're going to get a lot out of it. We're going to be right back with Dr. Stephen Lindenberg right after this important message.
Divorce and co-parenting are a major life interruption for families, especially the kids, but also for parents and grandparents. And it's even worse in blame-filled, high-conflict cases. When parents engage in alienation by turning the kids against the other parent or grandparents, kids suffer. They're denied the opportunity to build the 4 big skills necessary for future resilience. New Ways for Families online class can help. Parents learn to use our popular BIF and EAR skills to calm the conflict and stop the hostile emails and texts. And we even have a class for kids and parents to learn together. Research shows a 75% improvement in joint parental decision-making after this course is taken, plus overall improvements for kids' well-being. Don't wait to make this affordable investment in your children's future and improve your well-being too. Start learning new ways for your family today at conflictplaybook.com.
Hi, everyone. I'm Elaine Cobb. I'm founder and president of Family Access Fighting for Children's Rights. I'm also the host and executive producer of Families Divided TV. I wanted to tell you about our upcoming fall conference, which is a virtual international conference, October 5th and 6th. It's titled You Asked, We Deliver. I had sent an email blast out so you guys could send in what you wanted us to talk about in the different topics. Usually we have just one topic. However, this time we've chosen as our last conference to have all different types of topics that you guys have chosen and that mean a lot to you and we consider hot topics. So I wanted to just explain a little bit of them to you really quickly. We're going to have Dr. Edward Crook as one of our keynote speakers. He's going to be sharing with us his findings and his paper on grandparents who have never seen their grandchildren. He did a study on this for almost a year and a half, and we asked him to do it, and he kindly said he would, and we were very grateful, and we're really excited about hearing what he's got to say. This study that he has done is going to be able to be used in courts, in the legislature, in trying to get laws. We've never been regarded, as you all know, I am an alienated grandmom who's never seen your granddaughter dare, and they're, her parents, Brian and Kate, have not allowed Brian's side of his family to see him, to spend time with her. We've never met her. So we're really excited about this because when you go to the legislature, all of the bills state in every state that you need to have had time and a relationship with the child, whereas many of us in the world have never had that opportunity. So this is a huge breakthrough, and we're very excited. So you want to be tuned for that. Our other keynote speaker will be Bill Eddy, and he's going to be speaking to us on court trends, the trouble with letting the children decide. That's a huge topic, and it's knowing that it's Bill Eddy, it's going to be huge. So we're really looking forward to that. Dr. Joshua Coleman is also going to be one of our presenters, and he's going to be speaking to us on the do's and don'ts on reaching out to your alienated and estranged children. We all know Dr. Coleman gives us great advice and insight, so this will be a wonderful presentation. Dr. Sue Kornbluth will be speaking to us on managing personality disordered co-parents who alienate their children. Co-parenting is very difficult, and in many cases, it doesn't work, sadly. But Dr. Sue Kornbluth is going to give you some pointers on this, which will be very important and very effective. So you want to be able to be a part of that. And Dr. Mary Alvarez has got a very interesting topic, which we're really looking forward to. It's called Parental Alienation, Toxic Stress, and Your Child's Brain. This, to me, is so important because we often wonder what our children are going through as they're with the alienated parent and with the alienator, and also what it's doing to their brain and what are they thinking. So this is going to be very important. So I hope you'll be a part of that too. Chris Turner is going to be speaking to us about trusting and understanding agents of the court in high conflict cases. And that will be all the different professionals. She's going to be hitting on all of them that work in the court system. So that's going to be huge. Dr. Kelly Baker is going to be speaking to us on a topic that we've never covered, which is about teens. We've never talked about teens ever in any of our presentations, and that hit me. I'm like, oh my, we really need to get this out there. So she's going to be speaking to us about therapeutic interventions for parent-child contact problems with teens. So that'll be really great. Melanie Gill, who has done some fantastic presentations for us in recent weeks, she's going to be speaking to us on pathological liars, and her title is called Liar, Liar, Pants on Fire. And you know, if it's Melanie, it's going to be great. Dr. Kathleen Ray is going to be speaking to us on understanding the realities of a reunification program, dispelling common misconceptions. This is going to be very important that we get to see this presentation. There's so much false information being taken around out there, fake news, if you will, and lies also. So this will be great coming from Dr. Ray, and you need all your facts, and facts is what we need. So stay tuned for that. Attorney Chris Smith, who is one of our best attorneys, who is really, really great. He really cares about families. He's going to be speaking to us about secrets to litigating parental alienation allegations. And that'll be really good. And Randy Fine, who does some great work on narcissism, she's going to be speaking on confronting the mirror. Do narcissists face their own reflections? That's a huge question. And Dean Tong is going to also be really bringing us a strong topic, false allegations of abuse, navigating the three-ring circus. That's going to be really good from our forensic professional, Dean Tong. So that's going to be great. Now, I want to let you know, early bird special is now. You're getting, a great discount. This is a 2-day event, and you can register now. Please go to the link that's included here in the comments in our YouTube video, and it will take you to the webpage and also where you can register. I do hope you'll be with us for our very last conference. We are really looking forward to it. We have got some powerful presentations. And last but not least, I want to tell you, I almost forgot, but it's so important. We're having a 3-person panel on the Cadence Law. Cadence Law is destroying families. And we want to talk to you about the legislator and how we can go around that and do other laws. We're going to have on that powerful panel Dr. Lynn Steinberg, Rabbi Yaakov Achabam, and also we're going to have with us Robert Garza, who's traveling the country doing lots of work. These three know much about Cadence Law and about family law and the legislator. You want to be there for this. our families are at stake, and it's hugely important. So don't miss this panel discussion. Okay, guys, so I've left you with huge presentations and much excitement there. We're really excited about it. We're also going to have on Sunday night a time where you can have a support meeting where you can talk about your case and your different things, your testimonies, and we're going to enjoy doing that. And also on Saturday night, which has been really great every time we've ever done it, we're having from 9 p.m. till 7 a.m. One-on-one talk, what I call lovingly Chatty Cathy, because we have people that stay on there practically all night long and just talk and share their hearts and give each other suggestions on what to do. And it's a great time. So, okay, I've said enough. And if you have questions, please email me at familyaccessinc@aol.com. Happy to answer the questions. And I really, really look forward to seeing you October 5th and October 6th. Don't miss it.
Hello, everybody. This is Dr. Steve Lindenberg. I hope your new year is treating you better than last year. And I'm here to talk about a difficult subject again. This time, I'm going to talk to you about the devastating effects of parent alienation on children of alienated parents once they become adults, the adult children of alienated parents. Much of what I'm going to present today is based on research published by Dr. Vinita Mehta, M-E-H-T-A, and she published it in Psychology Today on January 8th, 2024, so it's fresh off the presses. And I want to emphasize 3 points, and I'm going to talk a little bit about the end before I go into the beginning. There is help for adult children who have come from families that have suffered from parent alienation. You have to make sure that the person that you're seeking help from, however, is somebody who is skilled in parent alienation and also reunification therapy, because sometimes relationships cannot be repaired or reunified, and that person has to be able to help you deal with the grief and bereavement process, which I shared with you the last time that I presented. So 3 areas, in moving on, 3 areas of struggles for adults who have suffered through parent alienation as children include mental health difficulties, self-esteem issues, and substance abuse. That shouldn't come as a surprise if you've read anything about any kind of trauma. These traits and attributes are common to anyone who has suffered a major trauma. The difficulty here is that the family unit is your primary unit of security as a child. And when you can't trust what went on during that period of time, it's difficult to wrap your head around that as an independent adult. And that's why I made such an emphasis about the need for therapy with a skilled clinician. So let's break this down a little bit. The mental health difficulties. All of the participants in Dr. Mehta's study suffered from identified mental illness, ranging from anxiety and depression to post-traumatic stress disorder to suicidal ideation. And they attributed that to suffering as alienated children due to their parents' abuse. Their self-esteem, particularly the alienating parents' abuse, I should make that clear. It is the alienator who is the abuser. It is the targeted parent who is being abused. And it is a child who is also experiencing severe child abuse. In fact, some researchers say that the child abuse suffered through parent alienation is worse than child sex abuse. So let me emphasize that again. We're talking about the effects that are largely the result of the alienating parent when you're talking about mental health difficulties. Self-esteem issues, the participants in this study reported having low self-esteem and low confidence in themselves and in their abilities. And you can imagine why. It doesn't take a rocket scientist. You know, young children feel that they are the cause of their parents' divorce, that because the parents are often fighting over the children, and parent alienation is puts that fighting on steroids. So the children are always trying to fix it and always trying to figure out what did I do wrong that my parents can't get along. And that carries forward into adulthood because your brain is forming as a young child, particularly between 9 and 14 years old, and which your pathways and your synapses and all those sorts of things are forming, helping you to form your identity and your reactivity to stress and environmental issues. And then we get into, of course, substance abuse. Alienated children uh, disclosed using alcohol and drugs, some at a very early age to cope with abuse. And I would also add to that from my own experience that many teenagers in um, parent alienation families also act out sexually. So they will look for reassurance and comfort in sexual relationships that are romanticized. So let's break this down a little further. I'm going to talk about relationship difficulties. So this, in Dr. Maida's study, she found 5 sub-themes regarding relationship difficulties of children who grew up in families where alienation was present. And we're not talking about mild alienation. I mean, there's in almost all divorces, there's some level of alienation. We're talking about, if you look at Dr. Burnett's 5-factor model, level 4 and particularly level 5 uh, stages of alienation that are very moderate to severe or very severe. So in those relationships, the adults found that they had difficulty relating to their peers. It was difficult to confide their experience about parent alienation because you feel self-conscious about that. I mean, most children grow up in families that are somewhat dysfunctional, but the families stay together and the children are loved and appreciated and not alienated from a targeted parent. They may have other issues, but that's not one of them. So it's very difficult to talk about that because talking about something makes it real, right? If you can think about it in your mind, and you don't have to say it out loud, then you can imagine that you're exaggerating it. But once it comes out of your mouth, it's out there and you can't pull it back in. And you have to either suppress it or deal with it in some other ways. There's also a fear of loss of relationships because look what happened to mom and dad. They fell apart, they lost their relationship, and in some cases, you lost your parent. The targeted parent may have been so totally alienated that he or she just gives up, moves away, and starts a new family, leaving you behind. And I'll talk about that a little more in a second. There's also great difficulty in trusting. Um, the alienated adults who were alienated as children have difficulty believing that someone would support them, that would find them lovable, that would be willing to sacrifice for them and put their own needs aside. They often hide their difficulties from others, and they often get into dysfunctional and abusive relationships themselves. So these adult children often choose partners who are abusive, who are as abusive as their alienating parent. So they identify who the alienator is and who the targeted parent is, and they occasionally take on the role of the targeted parent, or the codependent parent is the language of substance abuse. And they do that, and we're talking about them as they. And I'm conscious that some of you who are listening have suffered through uh, uh, being a child in a parent alienation situation. And so if any of this touches a nerve with you, You have my empathy. I apologize to you, but I also need to address the audience globally. So, um, so yeah, in a codependent relationship, you become an enabler. You do anything you can to keep the abusive partner, the intimate violent partner, from rejecting you because you saw what happened to your mother or father when they were targeted by the alienating parent. So you sort of identify with the targeted parent and react as though the other person was your alienating parent. I hope that's somewhat clear. I know it's a kind of a difficult concept for many of us. Um, and they'll defer because they don't want to be rejected. They've been abandoned once already. So that adult wants to feel loved. And so sometimes that adult will stay in an unhealthy partnership to avoid divorce at all costs. They don't want to go through that abandonment that they went through as a child, that abuse, that having to make a choice, that having to make up stories, having to fabricate lies, having to form an unhealthy attachment bond with the alienating parent at the expense of the attachment bond with the targeted parent. Not surprisingly, these uh, victims of child abuse as adults felt a lack of having positive role models. And so they had mental health problems, which we discussed a little earlier, right? And they have poor relationship skills, which made relationships challenging. So the other partner could be very loving and caring and sometimes rescuing, and the adult child from an alienating system will test the relationship, will initiate arguments, will say, "How could you possibly love me? My parents didn't love me. You know, why are you so nice to me?" Trusting, saying, feeling, um, testing that attachment, testing that bonding, testing that commitment. Um, the trauma of alienation also impacts on learning and development, which is not a surprise because if you're going through that while your brain is forming, it's going to, what I call hardwire certain reactions and certain expectations of your life experience um, based on the experience that you're going through at the time of that development. So if you're in a loving, wholesome family where you're supported, where your parents allow you to take minor risks, where your parents help you build confidence, you become more independent. You become an independent, healthy adult. Conversely, if you're not, you have difficulties with learning and development. You have difficulties becoming an independent adult. And oftentimes you'll develop neuroses or even personality disorders in order to compensate. So, in terms of learning and development, Dr. Mehta found that two sub themes really emerged. One was identity, and one was education and employment. Let me talk to you a little bit more about the identity issue. After being told that the targeted parent was bad, of course, by the alienating parent and perhaps some of his or her family members, um, the children were conscious of the ways in which they were like the targeted parent and felt shame about it. So their identity developed with identification with the targeted parent in a lot of ways. And so their identity suffered as a result. Now you'll notice while I'm talking to you and sharing this information, I say that the alienating parent could be a he or a she, and the targeted parent could be a he or a she. And that's because while a lot of the literature features fathers as the narcissistic personality who alienates, and the mother as the uh, more passive, histrionic, codependent person who is targeted. Um, in my own practice, I've found that it can go either way, and that sometimes the alienating parent is the mother, and that creates even more complications for the child, because a mother figure is supposed to be what? Nurturing, loving, caring, supportive. But here she is acting frightened, paranoid, angry, anxious, alleging that the targeted parent, in this case, the father, is worthless, is no good, beats her up, mistreats her, and so on and so forth. So it can go either way, and I'm not going to say in my own practice. I would say it's been about 50-50, quite honestly. Um, Meanwhile, back at the subject of learning and development, we just talked about identity, right? That they identify that these adult children from alienated systems identify with the targeted parent and felt shame about that. Well, in their employment and education, they had difficulty learning and focusing. No surprise. If your house is in chaos when you're growing up, you're going to have ADHD. You're not going to have the type of ADHD that's hyperactive necessarily. It's going to be inattentive. You're going to be having difficulties focusing on school because, number one, you're probably not getting enough sleep, overhearing all the fighting and everything. And number two, if your parents are separated and alienation is going on, you're going to be worried. You're going to be anxious. You're not going to sleep well. You may not eat well. So you may not have the reservoir of resources necessary to be open to learning. And these children also felt blocked from fulfilling their academic potential and employment potential at school and in the workplace, because when they were growing up, the alienating parents' needs always came before their own. And so oftentimes the alienating parent turns the child into a partner, and we call that, as opposed to allowing the child experience childhood, we call that parentification. Parentification. So that's a word that you might want to remember, because when those boundaries are crossed, that creates that puts a responsibility on that no child should have on being a partner with the alienated parent. A targeted parent doesn't usually do that, not because they wouldn't, but because they don't have the opportunity, because generally court orders lean toward allowing the status quo, and allowing the alienating parent is very persuasive and convincing, so the child often resides with the alienating parent during any kind of litigation. Then there's an issue covered by Dr. Maida of another trait that happens, attribute that occurs for adults who were children in alienating family systems, and that's grief and loss. And I spoke to that at extent the last presentation I made for grandparents about grief and loss as a result of alienation, as a result of estrangement. But in the child who becomes an adult who came from an alienating system, there's also grief and bereavement. There's anger and emotional pain because it wasn't fair. It's the only system they knew. Their parents took away from them, created a mess for them. All their other friends were out playing and having a good time, and here I am in the middle of a tornado, a whirlpool, a psychological whirlpool, as it were. They feel as though they have missed out on their childhood. So they feel that they missed the basic learning skills. So if your parents are fighting and there's chaos and they're yelling at each other on the phone and there's lawyers involved and hearings involved, who's going to teach you how to cook? Who's going to teach you self-confidence? Who's going to take you to a ball game that's not going to be interrupted by the targeted parent showing up, or more likely the alienating parent showing up and creating a scene when you have your visitation with the targeted parent? So there's a sense that their childhood, they lost their childhood, it's been robbed. Um, and there's also a loss of innocence, because alienating parents do not generally make observations about society in general and teach appropriate social skills and manners. They're usually yelling, swearing, and throwing things at each other. So these children lose this this is a reality in life that most of us encounter as we age up and become 18, 19, and 20, older teenagers. Um, we 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 begin to acknowledge that our parents are fallible and that the world is not as idyllic as it's portrayed in children's books and so on and so forth, and in rom-com movies and family movies and that sort of thing. So there's this early loss of innocence, which is terrible because as adults, the children of alienated parents often become jaded, cynical, satirical, bitter, angry, and depressed. So those are two of the issues of grief and loss: the anger and emotional pain, and the feeling that they have missed out on something. That these adult children of alienating parents have a sense of loss. There's also a sense of guilt, which and let me explain that to you. Um, as they become an adult and realize that they were abused and misled by the alienating parent, and that comes with therapy. That doesn't come from sitting on a log and contemplating the universe. That comes from sitting with a skilled person who can help you um, work through those issues. And if that therapy is successful, then the next thing that the therapist has to deal with in this grief and loss section of the therapy, for lack of a better term, phase of the therapy, they they feel guilty. The adult child of an alienating family feels guilty about the way he or she treated the targeted parent. How could I have done that? Why was I so stupid? Why didn't I see that? Why did I push her away? Why did I take this parent or that parent's side? And they come to know that the targeted parent wasn't the one to blame, that they were fed a line by the alienating parent. And so there's guilt about that. And there's also grieving about the loss of the relationship with the targeted parent. Um, Maida cited one participant who wrote that most of her childhood memories were just um, wanting her dad up until the age of 40, wanting her dad. She had been alienated from her father by her mother, and she longed for a relationship with her father. But by that time, her father had moved on. And I'll just give you an example from my own practice that after a while, the targeted parent sits with the therapist and recognizes that the alienated child hates, in this case, it was a woman, the targeted parent was a woman, hates the mother so much that to try to pursue the relationship further would only cause more trauma to the child. And therefore, she wound up marrying the man she was having her extramarital affair with, got a new job, and relocated to New England from Pennsylvania, and and more or less started a new family and just cut off her children. She has some idea that they may want to come to her as adults and try to repair the relationship. I'm not optimistic about that. I have a personal acquaintance who lives 2 miles from her son, who was alienated from her son by the father when this son, now in his 40s, was a child. They live 2 miles from each other, and she sends him cards, she sends him birthday cards, gets no response, has no relationship with him. So that relationship is lost. It's like that parent is dead to the child, and that child is dead to the parent. And that's one of the tragedies of severe parent alienation. And the last aspect of the grief and loss set of symptoms, try saying that fast, there's a disappointment with the relationship with the targeted parent. That some of the participants felt that the targeted parent had moved forward, as I was discussing early, with a new relationship or a new family. That targeted parent didn't fight hard enough for them, gave up too soon, or was disinterested in them. And as a targeted parent, those of you who are out there have been a targeted parent, you know how expensive and how emotionally draining it can get to fight a narcissistic personality or an antisocial personality or a borderline personality. who have those traits or that diagnosis, because they are very energetic, focused, driven, have extraordinary energy and perseverance. And after a while, it becomes emotionally and financially exhausting. When I'm doing therapy with a targeted parent going through that process, I tell that parent, keep a log of every opportunity that you took to try to fight for the relationship with your child, because you may get the opportunity to repair that relationship when your child or children are adults. So keep a log, make make copies of all the cards that you send to them, um, make show emails and texts, save copies so that when they're adults you can say, I know you feel like I abandoned you and I moved on, but let me show you what I was doing that whole time that your parent kept from you, your father or your mother kept from you. And that can be dealt with in reunification therapy with a goal of repairing the relationship between the adult child who was alienated, uh, the adult who was alienated as a child, excuse me, it's difficult keeping these terms straight because I want to be clinically precise, but I don't want to take you into the academic weeds of it. So I hope you'll forgive me for that. And there's a couple of more dynamics that Dr. Mehta um, found. She found that there was disconnection and dysfunction, that the participants described leading segregated family lives, and they felt disconnected because they had an abnormal family, an isolated childhood. So they had limited or irregular contact with the extended family and had cut off contact with the alienating parent. So that means that they really didn't have a model for healthy long-term relationship, and sometimes their marriages failed and their families failed. And we that can be passed on intergenerationally or multi-generationally. So trauma can be passed on. So, for instance, if your parents had a dysfunctional relationship and their parents had a dysfunctional relationship, the likelihood is that they sought out partners similar to their parents, and that this dysfunctional behavior had been learned uh, in the past generation. So it was passed on to the next generation. So one of the goals, it's kind of complicated. You might want to read more about that. Look up multi-generational trauma or intergenerational trauma, because therapy is designed to break that cycle. If you don't break that cycle, you're going to repeat it and give a really terrible terrible, I don't want to say gift, but a terrible precursor to your children's relationships in the future. Finally, the last subject I want to address has to do with coping and healing. And this is what I talked to you about at the beginning. I want to make sure to reinforce this, that there is hope. There is always hope. Um, and and so what we work for in reunification therapy is trying to help targeted parents and children, adult children who have come through uh, alienation, strategies for coping, healing, recovering, and repairing relationships. So one of the things that I try to influence in my practice and others as well is resilience. That it's important to learn mindfulness and resilience. You don't have to be your parents. You don't have to repeat the cycle. You can break the cycle. And so Meta found that many participants coped by themselves, where others then went and leaned on the targeted parent. Well, that's not such a good idea, as you can imagine, because if you lean on the targeted parent, you may start to acquire codependent traits and have them reinforced. The children that were more successful as adults developed a bond with a caring and protective person who created an environment in which they were free to experience and share their trauma and be accepted and have the opportunity to grow from the influence of that loving, protective person. Many participants try to reunite through reunification attempts. Talked about that a little bit earlier. I'm not going to spend much time on that. And tried to reunite. They tried to reunite with the targeted parent, and for some, this was healing, while others, it was so-so, because they'd been so far alienated from the targeted parent that they could not recover. They could not recover from those. Remember, I told you about the hardwired feelings and thoughts and automatic responses. They could not recover from that. In the healing process, the participants tried to make sense of their past and use therapy. They found that identifying the experience of parent alienation was healing. One said that as she got a bit older, she decided to go see a therapist and started putting things into place and break the normalization of the life she was living as a result of going through the alienation as a child. And at that point, the insight comes that the patient realizes that what they went through was abuse. And now you have a breakthrough as a therapist where you can say, well, let's talk about abuse and how you can recover from that and stop being a victim and start being a survivor. So that's the goal of most therapy where there's trauma. In fact, all therapy that I know of. You want to stop being the victim and start being the survivor. Easier said than done, but that's got to be the goal, because if you don't become mindful, resilient, and determined, then you will continue to suffer from the effects of the abuse of severe parent-child alienation. And finally, the participants who recovered felt it was important to raise awareness about parent alienation and more or less summarize in their own minds at the close of therapy, what did you get out of therapy? What did you learn about yourself? How did it benefit? How do you think it might help your children? Do you think it broke the multi-generational or intergenerational trauma cycle? How do you feel as a person? Are you in recovery, or are you still a victim? Are you a survivor, or are you still a victim? So that's basically what I wanted to share with you today. I thank you for your attention. I would just review with you that it's normal for adult children who have grown up in alienated family systems to have mental health difficulties, self-esteem issues, and substance abuse issues. That's perfectly normal. It's not the best thing to happen to you, certainly not healthy, but it's perfectly normal. And it's treatable. That's the important thing. It's treatable. Find a therapist who has, excuse my language, or not excuse my language, but who has the chops in reunification therapy, who knows parent alienation, who's testified in court as an expert in parent alienation, who's sometimes who's taught it, who's published about it. Find find somebody with the skills. Don't go to any random counselor on the corner who says, "Oh, I can treat you for parent alienation," and starts handing you books and telling you what you should do and telling you what you need to do. No, you need to do the work. You need to go inside yourself, and you need to have a therapist that can walk beside you on that journey. Thank you for your attention, and I hope that this presentation has been helpful to you and your family.
Next week on Families Divided TV, Elaine Simmons and Jeff Morgan, who are parents estranged from their adult children, will discuss with us persisting through pain.